This is Pam. Today we are going to be I'm going to be going over Q&As, parasite Q&As, questions that you guys have sent in. We get a lot of questions every day to our website, also when I'm doing live events. So I just wanted to answer your questions today. And I wanted to share some amazing successes from our students that are working with us in the Live Disease Free plan. So you can get a sneak peek of what it's like when you start to even get ready to treat these parasites, and then also while you're treating the parasites. So these are live experiences from people that are right now in the program, and they are recovering from serious chronic diseases by treating the cause. They are treating the parasites that are causing the disease they're dealing with. So if we haven't met, my name is Pam Bartha, and I am the author of Become a Wellness Champion, and I am the founder of Live Disease Free. I was diagnosed with multiple sclerosis 35 years ago. And back in the day, that was 1988, I was told that there was no hope for me, that I would be completely disabled in time. Sometimes MS would affect people more quickly, sometimes more slowly. But as the expert, they told me that I would end up in a wheelchair and there was nothing that I could do to change the course of my life. And I had always been really healthy, and I really could not understand how you can go from being super healthy to having this mysterious, incurable disease. And so I really cried out to God for help. And very shortly after my diagnosis, I was given a book by my mother in law. And this was back in the 1980s. So there really was not a wellness revolution. But she thought, oh, they mentioned MS in that book. And so she gave me that book. And when I read it, that really gave me some hope. I didn't know that I'd be able to cure the MS. I didn't know what caused it, but it really made a lot of sense. And so from there, 35 years later, I have been able to live MS free for 35 years. We have coached hundreds and hundreds of students all over the world, well over 15 countries by now, helping them to recover. And some of the things that I'm going to share with you, even in the Q&A, are things that you are going to be able to use to help you right now. So go ahead and say hello and type your questions in the question box. I am going to come and join in and answer some of those questions if there is enough time. So going on to the Q&A, it's really, really important to be clear because I talk to people every day, and many of them have spent a fortune on their health, and they have tried so many different things to even treat parasites. So at first, most people don't know they have parasites, but then when they're trying to treat parasites, then they go from practitioner to practitioner, and the sad reality is that most practitioners do not have a very good skill at treating parasites at this time. They might know how to treat candida, but a lot of times they'll use herbs. Sometimes they'll use medications. They might know a little bit more about Lyme disease, but when it comes to treating worms and protists and even just recognizing other bacteria, we're really falling short. So what I wanted to do is just share with you how when I'm talking about multiple sclerosis in this Q&A, just think of multiple sclerosis is that we have a parasitic infestation. That's all we have. We have more parasites than maybe you do. Maybe you have a different condition. Maybe you just have symptoms and you don't have a disease. So we're just kind of farther down the road with the parasitic infestation. So the first question that really comes up a lot is like, how do you know that there is a connection between multiple sclerosis and parasites? Well, what I would encourage you to do for that answer is to please go on our YouTube channel, Live Disease Free. You'll find there is a infection playlist, and I also talk about that in my masterclass training. So we know that there is at least 100 years of studies where, let me backtrack. Dr. Alan McDonald found roundworms in the spinal fluid of every MS patient that he tested. So subject, people that had died, they had MS. He looked at their spinal fluid, at their brains and spinal fluid, and he found tons of small worms, roundworms, especially in their spinal fluid. And for 100 years, veterinarians have known that when those small roundworms, they invade or infect the central nervous system of domestic animals, those animals have symptoms identical to multiple sclerosis. And remember that a lot of MS symptoms are similar to other neurological diseases too. So we know the research about the roundworms in the spinal fluid. And then more recently, he discovered also tapeworm larval cysts and also developing tapeworms in the spinal fluid of MS patients. So Dr. Alan McDonald is the first to discover live parasites as far as worms in the spinal fluid of MS patients at the time of their death. That's really, really huge. And what's so sad is that routinely it is not common. It's really doesn't happen very often, if at all, that they're looking at our spinal fluid when we have MS. Let's say they do a lumbar puncture. They're not looking at the spinal fluid under a microscope. They're not looking for infections. And that is a really big problem. That needs to change, absolutely. And not just with MS, but with other diseases. We need doctors to be looking and more researchers to be examining the spinal fluid and the blood. And our stool tests are very, very poor too. So there is a huge connection between MS and fungus. That was the first thing that I learned about. And then multiple sclerosis and Lyme disease. And then more recently, multiple sclerosis with worms, roundworms, and developing tapeworms, but especially the tapeworm larval cysts. And I talked about that last week and the week before. So if you want to learn more about that, go to our livediseasefree.com website. And there you will see, you can just look in our, it's done in, it would have been the end of February, beginning of March 2023, that I've done 2 posts on the, and it's called neurocysticercosis. It's when these larval cysts end up in the central nervous system. It's actually a condition that's pretty well understood by the CDC and different organizations around the world. So it's a very serious condition. And it can cause different symptoms in different people depending on where the cysts develop in our central nervous system and how big they are and how many we have. It can even be a big factor in migraines or in epilepsy and many other neurological diseases for sure. Second question. Once we get rid of parasites, can we reverse multiple sclerosis? Well, actually, when you treat the parasites, you are reversing multiple sclerosis. You are recovering from multiple sclerosis. So it's not like you treat the parasites and then you have to do something different. You'll notice that as you are getting ready to treat the parasites and you follow the Live Disease-Free plan steps, you're noticing significant symptom improvements. And I'm going to share some of those with you today because they're truly amazing, truly miraculous. There's so much you can do with just diet and lifestyle. You definitely want to treat the parasites, but if you can even just start to get ready to treat, you'll have a lot of symptom relief. So once we get rid of the parasites, then we have, for most of us, we have a lot of recovery or full recovery. We can never promise full recovery because if there was a lot of damage done to a nerve, maybe there's a lot of inflammation or not just inflammation, that can be reversed, but if there's scar tissue, that cannot be reversed. So that's the exciting thing, is that we can stop the progression, we can have more recovery than we thought possible. The next question is, are there any herbal tinctures that are effective to treat parasites? So yes, there are different types of herbs that can be helpful in treating certain parasites. So for the very small protists, for let's say, for example, babesia or malaria, we know that artemisinin can be helpful, whether it's tincture, and then sometimes doctors can do an IV or an intravenous injection, and it's called artesunate, and that is really effective for malaria. But when we're talking about the larger worms, the tapeworms, the flukes, the roundworms, those bigger parasites, you may notice some different parasites that you're passing if you go to the health food store and you get, let's say, a blend of parasite herbs that would contain things like black walnut or cloves or wormwood. But what we have noticed, and there's other different lines, I'm not going to say the names of the different lines, but there's some that are really popular for treating parasites right now. And although you may pass worms and you might have a little bit of symptom improvement, if you have chronic disease, we found that the herbs by themselves are not enough. So they're not going to be effective enough to treat the parasites in our central nervous system. They're not going to be effective enough on their own to treat the larger worms that are in our intestine, especially in the small intestine. And so that's why we use a layering of treatments, because we've been down this road already and we know, and there's a lot of really great blends of parasite herbs. And there's things like Mimosa pudica, there's diatomaceous earth, there's the herbs I mentioned, there's lots of different options that are more natural, and you're able to find them, you're able to access them better. They're a little safer to use without you working with a healthcare professional. But again, if you're quite sick, you really should have guidance with any kind of treatment, just so that you don't end up hurting yourself or making matters worse. But the problem is that, again, the natural substances, we haven't noticed that they're strong enough on their own. And I'm not even going to say some of the names I can't say because we could get censored here, but just know that the natural herbs, let's say you're not a really sick person, you're really healthy, but maybe you've got a little bit of digestive issues, a little bit of gas, bloating, stomach ache sometimes if you eat the wrong foods, maybe a little bit of constipation or diarrhea very occasionally, but otherwise you're super healthy, you've got a lot of energy. You can use those herbs and you can try and see if that gives you enough health benefit. But for people with chronic disease, we found that the herbs by themselves are not enough. Another person is asking the question, is there a good way to test for parasites? You can spend a fortune on different DNA tests. You can spend money on different stool tests. There are a lot of different tests available on the market. And what we have found is that they're very limited with the results that they give you. We personally, in the Live Disease-Free plan, when we're helping our students recover, we don't worry about if you can get a stool test done where you don't have to spend money, it's not going to hurt, right? You can have it done. It might show some smaller parasites like Blastocystis hominis or maybe an entamoeba. It might show that you have candida, things like that. But it's not going to show the problem parasites that are bothering you, that are giving you the worst symptoms. We have found that it's very rare that they are showing up on the stool tests. So again, I'm not against them. It's just I'm really careful in how our students spend their money. And if they're not going to get if those parasites that are bothering them the most are not going to show up, then I just can't justify for them to spend $750 or $1,000 or more on stool tests or DNA tests. I'm really hoping that in the near future or the next few years that these things improve, these tests will improve, and that we'll have better options. Next question. Is there a specific diet that you should follow if you have parasites? Yes, in our opinion, there is, and we have called it the Live Disease-Free diet. Why is this diet so helpful? And you're going to see some of the successes that our students are having while following it. Well, parasites eat various foods, but their favorite food, some of you that follow my work, you know what that is, would be carbohydrates and simple sugars. And so when we decrease the carbs, then we notice that the parasites are not as active. They are going to be less active, or they're producing less toxins. Then we find that we have less inflammation. Our immune system is not dealing with it as much. And then we notice symptom improvements. And we can have some pretty dramatic symptom improvements with respect to bladder function, with respect to more strength, less spasticity. And if our bladder function improves, then we actually sleep better through the night. We wake up feeling happier and more refreshed and stronger. So there's so many different symptom improvements that we can have. Before we start treating, we want to support immune modulation. We want to support our immune system. And we do that through the Live Disease-Free diet and supporting the body. So the Live Disease-Free diet guidelines, we have those available on our website for free. So you'll see a little short video, like a 2 or 3 minute video, and then there is a cheat sheet where you can put it on your fridge and it tells you what you can eat and what you should avoid. And this is in preparation to treat the parasites. So carbs, if you're eating, whole foods and you're not eating too many carbs in a day, they're totally healthy. But when you are infested with parasites, then as we decrease the carbs, we notice a lot of support for our immune system. And that's just one of the steps. And then we also support the body in various other ways. So that is why this diet is really, really helpful. We're basically getting the carbs down to between 30 to 40 total grams of carbs per day. That's the magic of the diet. And so we're eating a lot of leafy green vegetables. We're eating low carb vegetables. We are working up to 9 to 13 servings of vegetables per day. We're having moderate amounts of animal protein to keep our muscle mass, and we are having enough healthy fat to maintain our weight. So as we decrease the calories from the carbs, we are increasing the calories from healthy fats. And then that way we still have energy and our blood sugar is steady and stable. And sure, the parasites are going to eat various nutrients and various foods from us. They're freeloaders, they live in us, but their favorite is carbohydrates. And that is what really makes them active. So that's why we follow that diet. And of course, it is dairy free and it is grain free, sugar free, caffeine free, alcohol free. But again, we can have lots of different vegetables and we can have lots of different herbs for seasonings and spices and meats and fats. So it's a very satisfying meal or food and very like you're not hungry ever. And if you don't want to lose weight, you have to make sure you eat a lot of food all the time. So it's very different than the traditional diets that many of us are used to. So is this approach only for multiple sclerosis? Absolutely not. Parasites are the main cause of all chronic diseases. And it's just that I attract a lot of people that have MS because that was my history. That's what I was diagnosed with. It's just that people with ALS and PLS and MS, PLS, ALS, Parkinson's, and Alzheimer's, those conditions are really serious and they have the greatest parasitic infestation. And of course, cancer is pretty significant also. So if we have other diseases that we're kind of managing, like maybe we've got like eczema and we've got asthma, or, arthritis is definitely not a walk in the park either. And there's lupus. They're all infectious diseases. They're all caused by different types of parasites. And to be clear, parasites are any microbe that lives in you and causes you harm. Again, bacteria, fungi, worms, and protists. So all of them can be a parasite if they're causing harm in your body. And then the next question is, would this approach help me with my bladder and bowel incontinence? So many of the students that start to work with us, they do have bladder urgency. They get urinary tract infections quite often. They may also have bowel intolerance. Or incontinence, pardon me, bowel incontinence. And if you have bowel incontinence, that means you've got a lot of parasites in your gut, in your intestines for sure. So yes, this is the approach. So we get ready to treat by decreasing the carbs, supporting the body. We're feeling a lot better. Then we get energy tested. I'll talk a little bit more about the steps in a few minutes. But yes, the live disease-free approach is exactly what you need when you're dealing with bowel urgency and incontinence and also bladder. Does MS affect if you're trying to have kids, if you would like to start a family? I haven't been able to get pregnant at all. So what I would say is that it's not the MS that's affecting your ability to get pregnant, but is definitely the parasites that are causing infertility. And also, I can't talk specifically here. I guess I'm going to have to end up moving somewhere else to be talking about these topics. But there was this, I'm not even going to talk about it, but just, recently, okay, I won't talk about it. But there is infertility that has occurred because of something that we've done medically in the past couple of years, and they're in a lot of women. So if you haven't had that treatment that a lot of people have had, if you have had it, that can cause infertility. It can cause a lot of women have their menstrual cycles messed up. But otherwise, traditionally, if you've had this for years that you've been infertile, we've had quite a number of students that join the Live Disease Free plan because they want to recover from a disease like MS or other. And then as they're treating the parasites, they're able, not while they're treating, but they're able to become pregnant later. So they are not infertile anymore. So Lisa May is one of them. She had multiple sclerosis. She is a nurse. And just through following the program, she recovered from multiple sclerosis and then she recovered from her infertility. You just have to treat the parasites. That's what does it. And then now she's got two beautiful kids. So we've seen that many times. So infertility, I believe, of course, there could be nutritional deficiencies and toxicity, but most of the toxins are coming from the parasites. So when you correct your microbiome and you're using a holistic approach as we do, we're supporting the body in various ways, but not expensive ways, but just basic ways, then yes, we have seen infertility correct tremendously. So it's not the MS that's causing it, but it is the parasites that are causing infertility for most people. Another person asked, my wife has body tremors, tingling in her legs and feet, memory, mood issues, sugar addiction, poor eyesight in one eye, and she is on 5 different medications. Do you think this approach will help for her? This is really the only approach that will help her. So she is on many, many different medications that are attempting to manage the symptoms of the parasitic infestation that she's dealing with. And I'm just going to share with you too, in these successes, like with one of our students just in the past week, she's said that she no longer has tremors. So that's very common, whether you have tremors in your voice, whether you have tremors in your arms or legs, and all the other neurological symptoms. So all the symptoms are caused by parasites. And although I can never promise full recovery, we stop the progression of the disease, and then we have more recovery than we thought possible. And very often it's full recovery, which is so exciting. What can we do for SIBO? SIBO is small intestinal bacterial overgrowth. And that means that we have bacteria growing in our small intestine, which we really shouldn't. And so we can get a lot of different horrible symptoms from that. It can make you feel really sick. And sometimes doctors might prescribe antibiotics, but that doesn't tend to be a cure. Also, there are certain antimicrobial herbs that we can use. There's Dr. Seebecker. She's really great. She's got a lot of protocols on her website for SIBO. But please keep in mind that if you have worms in your small intestine and they keep infecting you with bacteria, then if you just keep treating the bacteria, you never really recover from that. So the better thing to do would be to treat what's causing this bacteria problem in your small intestine. Again, using a holistic approach, right? We want to support the body in many different ways, just natural, exercise, activity, sunshine, what we eat. There's so many things we can do, but we do want to treat them and then bring back the good microbes. How long does it take to become symptom-free? That's so different for every single person. So if somebody has, let's say they have been diagnosed just within the past few years, but they're still functioning really well, they're still able to walk. Maybe they can't work, but they still can walk. They can still drive. It might take them 4 to 6 treatment cycles to become symptom-free, or maybe they're just pre-diagnosis. And if somebody who has been sick for 20 plus years, hasn't walked for many years, they might be treating for a year to a year and a half. The problem is that I've shared on my videos that a lot of these, especially the bigger worms, they can release hundreds of thousands of eggs in a day, in a single day. And many of them are dormant and they're hiding under biofilms. So if we have, and I keep saying this now, especially with what we've learned, is that for many of us, including myself, if my doctor, when I was a child, recognized that I had a lot of symptoms of parasites. I was really skinny. I had stomach aches all the time. He checked me and he ended up taking my appendix out. My appendix was fine. and I had a lot of constipation. I would have a bowel movement once a week. And so I had blazing symptoms of parasites. And if our doctors would have been able to recognize that, and if they would have known how to treat these parasites when we were young, I would have never been diagnosed with multiple sclerosis at the age of 28. That is such an important and huge, huge statement to make. And that's for most of us, is that when we had these weird symptoms, if the doctors would have kind of gone, okay, that sounds like you might have a parasite, let's do some testing. Again, they don't have good tests. They haven't been trained in treating parasites. They really believe, they've been told that parasites are only an issue in underdeveloped countries. So somebody else asked, how long is the process to heal? So I just answered that. It really varies from person to person. But I can't say for sure because one of our students, she'd been in a scooter for 5 years. Her mom died, Terry, which I share on my masterclass training. So she literally was in a scooter for 5 years. And in 3 months of following the program, she was able to start like not walking because her leg muscles were like they atrophy if we don't use them. So she was able to start using crutches, and then she was able to get on her bike and start to exercise and doing squats in the doorway in 3 months. So we have had students in 3 to 4 months not use their walker, their wheelchair, being able to come out of it. And then some of them that have been a lot, quite disabled for quite a while. And I'll share her success. Like she's able to stand up and start, preparing food, which is really exciting. So everyone's different. You work at your own pace. Some of our students have been sick for longer periods of time. Some of our students have more support. Some have less support. Some people are in extended care homes, so it's a lot tougher then. So we just move forward. And some of us can move forward more quickly, and some of us have to kind of be like the tortoise, instead of the hare. But you still get there. You still just do your best. As long as you're being true to yourself and you're implementing well, you still get there. And it doesn't take years and years and years, not the years that it's taken to get you to this place, but it could take months. And the more we get our doctors to take this over, and the more research we go into better testing and better treatments, then we are going to recover more quickly. I truly believe that, but we have to get the word out. And what you can do is you can really help to share the work that we do here. Start talking about parasites in different groups. So it's not just getting our practitioners. Yes, start talking to them, and don't say, there's this lady in Canada who says that parasites are causing MS and all chronic disease. Share Dr. Alan McDonald's research with them. The study where he found the lecture. We've got all of that on our website, and it's in our blog posts. So share that. That is profound, right? And if you do know of a doctor that's really interested in this, have them reach out to us. And we would really like to share anything that we've learned, everything that we've learned, and collaborate and really take this out of our hands. We don't mind coaching people in diet and supporting the body and all these lifestyle things. But the treatment, we need to have better support while treating these parasites from our practitioners. That would be ideal. And it will come eventually. But for those of us that are sick right now, we can't wait. Is there any way to tell how long the lesions have been present in our body? Well, at this point, no, because the panel that has decided how we are diagnosing and treating MS, they will not, or they say there's no value in looking at the spinal fluid for infections. Instead, they are really concerned more about lesions, about the change of lesions in space and time. So over time, when they first see you and they do the first MRI and they're monitoring you before they give you a diagnosis, are they noticing the development of more lesions in different parts of your central nervous system over time? But we know in research that lesions are caused by parasites. That's well known in research. And I'm going to do a talk on that in the next little while. And again, you can share that. But they don't want to know what's causing the lesion. They're like, no, it's just your immune system is attacking your tissue. That's what the lesion is. And it's like, really? What does the immune system really usually do? Oh, the immune system defends us from infection. Oh, so why wouldn't we look at the spinal fluid, right? Why wouldn't we? And then when you see the panel, how they are funded heavily by the companies that gain to make a lot of money by selling the treatments, they are funding the way that MS is diagnosed and treated. That's a huge conflict of interest. And that is on the McDonald criteria. Go to our blog post last week or the week before. So we don't know when the lesions happen. Probably for many of us, we've had a few lesions. We could have had them for years before we were diagnosed. Absolutely. And it's just when the lesions become, when the cysts, if let's say it's tapeworm, but it could be others too. We know Borrelia, which causes Lyme disease. We know malaria can cause a lot of MS symptoms. So, whatever's causing the lesions, if we had just a few, because there's a lot of people that don't have chronic disease. If they're over 50, they have lesions in their central nervous system, people with Crohn's disease, and I'm sure other diseases. So, lesions are not only characteristic to multiple sclerosis, they're characteristic to elderly people. I'm over 60, so, just even like anyone over 60 could have them. So the key is that, if our doctors could recognize the parasite symptoms in us early, and then if they wanted to do an MRI at that time, then they could also, test the spinal fluid using the different testing methods that are, there's a blood test that we can do for the neurocysticercosis, and also looking at the MRI scans and the CT scans. But how long the lesions have been there, probably for a few years before we were diagnosed with an incurable disease, I would assume. Are there any supplements or vitamins that I would recommend? Most of us have a cupboard full of bottles of vitamins, and many of the supplements, we're not taking them. We don't even know why we bought them. They didn't really make a difference. So we don't recommend a lot of supplements because it gets to be really expensive and they really don't make a big difference in the whole scheme of recovery. It's good to, number one, increase the low carb vegetables. And I just wanted to mention too that if you have inflammatory bowel disease, you're not going to eat a lot of raw vegetables. You definitely want to eat the vegetables that agree with you. So just avoid the vegetables that don't agree with you and cook the vegetables until the inflammation has settled in your digestive tract and you no longer have diarrhea or get stomach pain from eating raw foods. So just eat the vegetables that agree with you, but saute, stir fry, oven roast, or cook your vegetables is absolutely fine. But with respect to supplements, just a good multivitamin mineral from plants, maybe some extra calcium because our food is quite deficient in calcium. Iron, if you're deficient, if you have anemia, which is really common. B12, which is really interesting. If you are deficient in B12 because of the parasites, then you definitely could take some B12 sublingually, but depending on what your test result is. But we don't use mega doses of vitamins. And then, I'm just trying to think that calcium and vitamin D3, that's what I wanted to mention. So if you're in an area where you don't get a lot of sunshine, like Canada in the winter, then vitamin D3 is also helpful. But those are really the main supplements that our students would take. And we don't take a lot of other supplements that support mitochondrial dysfunction. We just haven't noticed that they make a big difference. I mean, if you're taking something and it's really helping you, then I wouldn't stop taking it, but make sure it's not synthetic. That's really important. All right. And can parasite zappers help you? So I have Dr. Hulda Clark's, the electrodes, like the zapper that she talked about, and I've used it. And there's also another doctor, and I can't remember, Dr. Beck or something like that, where you put this like a little battery thing on your wrist, and it's like a microcurrent. And then I also bought that other little zapper. So I've tried all kinds of different things, and honestly, they haven't made any difference. So I'm not saying that they couldn't potentially help with any parasites, but when you have chronic disease, so like for myself, if I had a lot of big roundworms and I had tapeworms and flukes, then the little zappers is not even going to touch it. Like, you won't notice any symptom improvement. So personally, um, they're not harmful, but are they worth the investment? I can't say that I would endorse that at this time, just because I haven't seen a lot of benefit with any students that have used those or myself. And again, like, if we're not careful, then we can spend thousands of dollars in our health in the integrative field. And then is that any better than the medical field, right? So this is where we have to just really be aware and cautious, so that people that we're supporting and coaching in their recovery, that they can afford to get well. That's really, really important. And there's so many things that in theory they could be helpful, but in reality, they really don't make a big difference. And if that's the case, then save your money for things that are helpful. Thank you so much for your kind words. And that is the life coach medical mode. Thank you so much for your kind words. Susie, hello. Anthony, I have multiple sclerosis, spasticity, weakness, tinnitus, and I just need to prove that I have parasites. I believe in my central nervous system. So if you can spend all of your energy and your effort trying to convince healthcare professionals that you have parasites, and in the end, it's not going to work for you. You can either sit and wait for things to happen, or you can make things happen. So if you're at the place where you really, really believe you're dealing with parasites and you can't find support and you can't find help, then make sure to watch my masterclass training, and you can watch that and you can see the steps that we take. And if you would like our support, then you can book a time with me to talk more about, your questions that you have to make sure it's a good fit for you. But this is exactly what we help students to do. We help them to build a game plan. We help them to access the treatments and the practitioners that they need to work with. And we work with students all over the world. So that is something you don't have to wait. That is the key. And I personally wouldn't wait, because with MS, you never know when the next attack is coming, and you never know if it's going to be, really disabling. This work is so important. Although the carnivore diet is helpful, but but feel confident it is only a good start. So yes, there is a carnivore diet, and I'm not opposed to it at all. And some people follow it because that's the only way that they can feel okay. So they have to get rid of all carbs. But just remember, it's the parasites that are causing your symptoms. So although the carnivore diet might help you to feel better, but the parasites are still living in you. They will continue to multiply, to grow, to move to different parts of your body. And so we do need to treat them also. And it is very enjoyable to eat more food, to eat different foods. But if you are using the carnivore diet, just make sure that you are not eating a lot of meat. It is a lot of fat, and then just moderate amounts of meat. Because what we have noticed in our students is that they're allowed to eat animal protein with a live disease-free diet, but if they eat too much animal protein, their symptoms are much worse, right? The parasite symptoms are much worse. But if they just have moderate amounts of protein, so for a woman, it would be like 3 to 4 ounces per meal. For a man who's maybe more active, maybe 4 to 5 ounces. But if you're going to like a 10-ounce steak or 6 to 10-ounce steak, that's where people have shared with us that they can have a lot more symptoms, neurological symptoms. And I believe that is because our body can convert the extra protein to sugar, and that makes our blood sugar go up, and that'll feed the parasites. So the carnivore diet is a lot of healthy fat and eating moderate amounts of animal protein. But we have found that most students can follow this diet, where it's a little bit more enjoyable. It's not quite as restrictive. You're enjoying different flavors more, and they still do amazing. Our carbs are still quite low. They're, again, 30 to 40 total grams of carbs. Yes, this is live. Darren, I am looking to participate in energy testing. How? So, Anthony, the way that energy testing is done, it's number one, it is like biophysics, meaning that all living things have an energy field around them. And sometimes, if we have parasites or if there's a lot of toxins in us, and if we're weakened, then our energy field could be weakened. And the whole premise of energy field is when you bring in the remedy into your energy field that's appropriate for you, it balances you, it strengthens you, it makes you um, more stronger. So they're able to test different supplements and different parasite treatments to see which tests the best for you. So it's not testing which parasite you have, although if you test really well for 2 or 3 parasites to treat tapeworms, you probably have a tapeworm. If you test really well for 2 or 3 parasite drugs that treat roundworms, then you probably have roundworms. And the same thing goes for flukes and for fungi, etc. So there are specific treatments that will treat fungus or treat certain protists or treat roundworms or tapeworms or flukes. And so instead of trying to figure out which parasite we have, because there's thousands of them and we don't have good tests, instead what we're doing is we're like, okay, which of the treatments are testing best for us? And those treatments will help to kind of give us a clue of what we're dealing with. And then also when we're doing the enemas and we're passing these parasites, and I can't talk about those special enemas here, but if you're new to my work, make sure to go on to even our website, livediseasefree.com, to a blog post using oxygen therapies to treat parasites, or you can even find it on Rumble, the video. And there I talk about the special enema that we use that's really cost effective. And then if you're treating with parasite drugs that treat tapeworms and you're passing these really big worms that look like tapeworms, you probably have tapeworms. Same thing with roundworms, etc. So we're using a combination of things. All right. And then somebody is asking, if the urine smells like ammonia, is that a sign of ketosis or parasites? To be really honest, we're not worried about ketosis, so I don't know. What we're doing is we're just going low enough carb so that we notice a lot of symptom improvement. So our students are not actively trying to get into ketosis. They're just getting the carbs low enough. So their blood sugar is usually still in the normal range, maybe a little bit low on the normal range, but they have lots of energy because they're getting their energy more from fat. Their body is more of a fat burner on the Live Disease-Free diet, but we're not really worried. And I know that parasites can definitely produce ammonia, so that could be what it is. But if you have any concerns with your urine, that you feel you have an infection, make sure to get that checked, because when we have a lot of chronic disease, our bladder becomes compromised. A lot of people have urgency and urinary tract infections frequently. And sometimes they don't even know they have an infection. They might just have a fever. They might just not feel well. So just if you have any indication that you have an acute bacterial infection with your bladder, you need to get it treated properly because you don't want any damage to your kidneys, etc. But once you treat the parasites, you're not going to have those frequent urinary tract infections anymore. So you do what you got to do to get stable, to kind of get out of the danger zone, and then you treat the parasites, and then your bladder can heal. And we've seen that over and over again. Hi, Carla. Thanks for joining in. So how long is the process to heal, and what is the cost? So this is Ahmad. So what you can do is watch my masterclass training, and it goes into a lot more detail about the steps we take. Just in a general sense, really important to, number one, stop feeding the infection so much. Number two, start supporting the body. Those 2 things are called the prep phase. And in those 2, I'm just going to go to the successes here right away, but then you can start to see like amazing successes. Then we start treating. And we do cycles. And a cycle would be 10 to 14 days of treating worms and protists, and then 10 days of treating fungus, whether it's, sometimes we have more mold, sometimes we'll have more of the candida, and then we take a break week. But during the break week, our students still treat, but they're using more herbs If they have a history of fungus, they might use more herbs that treat that. If they have a history of testing positive for Lyme disease, they might use a really good blend of herbs to treat Lyme, etc. And then we are using the oxidizing agent, especially through enemas, because we have found that even using these parasite drugs at the recommended amounts that the physician's desk reference that pharmacists prescribe and doctors prescribe, is that it's still not enough to kill the biggest of the parasites. And we've seen so many worms that are like 1.5 to 2 feet long in our students, like really shocking. They're not the only problem, but they are definitely a very big part of the problem. So what I'd like to do right now is just share. I'm going to keep the names anonymous because these are students that are just on the journey starting to recover. Some of them are just in the prep phase, the diet and supporting the body. They're getting ready to treat. And other students are actually in the treatment. And I should really do this weekly. We should do like a Friday weekly, because when I hear their successes, I'm like, the neurologists are not hearing these successes from their patients. I can guarantee you that. And we're seeing this every week in our students. And we have for years and years and years. It's just so, and that's why we do the work we do. So one student shared, I have absolutely felt and seen improvements when I started my second treatment cycle. My energy is so much better and I'm having regular bowel movements, sometimes 2 to 3 a day. Most of our students have severe constipation from the parasites. So when they're able to have regular bowel movements, it's a pretty big deal for them. And he said, February 2023 was the best for me. I did more than I have in years, and it felt so good the whole time I was experiencing it. My walking has improved, and I've also noticed some forward movement in my legs as I walk instead of walking outward. So this gentleman, he is treating. This student is treating. Plus, I can now slowly turn 180 degrees in one spot without any assistance with a wall or a cane. Navigating has improved also. Awesome. And then another student shared, I'm following the diet and I'm drinking more water. So he's newer. He's just kind of starting to follow the diet, and he's noticed an improvement in his spasticity already. Another student shared, successes, daily bowel movements, lower back pain has stopped. Very often, lower back pain is caused by parasites. Spasticity in legs has ended, and I sleep 7 to 8 hours. So this student is not treating yet. So her spasticity, the cramping in her legs has stopped. She's sleeping 7 to 8 hours. Her lower back pain is gone. She said, I have not had consistent sleep for 5+ years. I was diagnosed with PPMS, primary progressive multiple sclerosis, in 2017. I'm so overjoyed. But wait, she said, there's more. The tremors in my left hand which started 7 months ago, that was before she joined the program. She said, I woke up today and I poured water without splashing water out of my glass. So her tremors have diminished in her left hand, which is amazing. And she said, I was able to text this morning successfully without dropping my phone. And she said, I am so excited about this progress. I have so much more work to do, but woohoo! So it's awesome. And then another student who is on his 4th treatment cycle, he's had tremendous improvements in his leg strength and spasticity gone. So he's finished the 4th treatment cycle. He said, I'm feeling so much better. And he's also noticed that his urgency and bladder capacity has improved. I'm able to hold it until I make it to a bathroom, and that's a really huge improvement. Another student has been on the diet just for 10 days, and she said, during the past couple of days, I have a little more strength in my legs, and my bladder urgency has definitely improved. So we normally see significant improvements in bladder function in as little as 1 to 2 weeks just with the diet alone. Another student shared, I'm feeling more energetic. It has been 2.5 weeks on the diet, and I specifically have noticed more energy in the afternoons, dinner, and the dinner hour, which is so needed because I have 3 young kids. And she also had vertigo, and that has settled down also. She's just getting ready to treat. Another student following the diet feeling so much better, having more energy, less spasticity, no more brain fog. Her mood has improved, bowel movements once or twice a day, sleeping well at night. Over the past couple of weeks, I don't have to sit on my right hand to keep it unbent or straight. I can pet my dogs more often with this hand, and I'm able to make eggs in the morning. And I'm now able to use my hands to open the eggs. I also noticed that my toenail fungus is almost gone, and my nails are just growing nicely like they're supposed to. I'm starting to do more physical activity and breathing exercises an extra 10 to 15 minutes per day, and it's making me super happy. Another student, I'm feeling, so this is just what came in the last week, and this is not all of them. I just took out, just so that I could get through this a little bit quicker. But just gives you an idea of this is our Christmas every week. I'm feeling better, no more back issues. So this is another student that had back issues, and she's just getting ready to treat. I've been having issues since 2003. I find my eyesight is more clear already. I have cataracts and the start of glaucoma. So she's noticing improvements in her vision just in a couple of weeks. Another student who's treating, she said, I am noticing improvements in my skin. I no longer feel that very often we have to pop our ears, so the inflammation in her ears is definitely going down. She's been able to put some weight on. So when we treat the parasites, if for those of us that have been underweight, we're able to put weight on. She said, for the past few nights, I've been laying in bed on my back, and I'm able to pull both legs up to a bent knee position without having to use my arms to pull up my leg or to pull up my right leg, which is so awesome. My tailbone doesn't hurt anymore. The white spots, scabs continue to disappear. Another student, she shared, I'm getting my vision back and I'm seeing some improvements in my mobility. She's just getting ready to treat. Another student who is not treating yet either, or maybe, no, she's just starting to treat. I'm trying to think. I have 2 or 3 students with the same first name. Anyhow, so she shared, I continue to see areas of improvement. I walked this morning lifting my right leg clear off the floor, no dragging. My breakfast was made on my feet, not in my electric chair. I also noticed my gut does not bloat as much as it used to after a meal. That is amazing. Again, just getting ready to treat. And then one more here. I have more and more energy. I was able to let the dogs out, feed them, vacuum the rug, cook and clean up the kitchen, do some laundry, straighten up the dining area, and take out the trash all in one morning. So this is someone, I'm sure she's recovering from MS and just getting ready to treat again. She's not treating yet. I have more movement in my right ankle, and I'm feeling and more feeling in my right leg. I can move it around more easily now. My right hand, which was also affected by the MS, so yes, she had MS, is not as tight as it used to be. It doesn't shake, tremors going away. She doesn't have the tremors. And it's stronger than it has been in a long time. And my right hip area is becoming much more loose, which is helping my gait. I feel like my body, core, muscle structure is loosening up and working together, better together, more cohesively. It is nice and unusual for a feeling for me. And I'm able to get 8 to 10 hours of sleep. That's another thing we work on because a lot of our students have a hard time sleeping. And so she's sleeping really well. And I'm seeing if there's anything else. So she hasn't, I can't tell you the last time that she has slept like that. It's been years. She's also titrating off of one of her medications with the consulting with her doctor and her pharmacist. She doesn't need it anymore. And she's tapering down very slowly. Her bladder has improved this past week, which excites me, she said. I feel like I'm starting to get the hang of this. At first, I wanted to rush and to get started on the treatment right away. I'm so glad that I haven't started yet. I want to make sure that I get it right and I don't rush my body and that I fully understand what you are teaching. I am so, so grateful for all, to you for all of this. I can't say thank you enough. And then the last couple of students, one is finishing the medication of her treatment cycle, and she has a lot more energy, and she was able to cut her husband's hair because her left hand fingers and arm were not as weak, which is so awesome. The last one, a student recovering from Parkinson's disease, she did that special enema, and she sent me a picture of the worm she passed, and she noticed that her legs were stronger after she flushed out that parasite. So this is something that we see week by week, which is so incredibly excited. I have hundreds and hundreds of pictures of these parasites. All right, I'm just going to go to maybe one or two more questions because we've gone on a while here. Yes, make sure, Huma, to watch my masterclass training because that explains the whole process for you. And does a person have to stop the disease modifying treatments when they start the program? No. I'm not a doctor. I can't tell you to stop medications. What I will do is I'll recommend that you research them a little bit so you understand how they're working. And so as our students join in on the program and they start to prepare to treat, and they're having all these wonderful treatments, my goodness, I'm too excited about their successes. They're having all these wonderful successes that I just shared with you. Then they are starting to look at the drugs they're taking, and they really believe, they know in their heart that the parasites are causing their disease, and they're feeling so much better. Then they talk to their doctor and or their pharmacist, and they come off their medications when they're ready. It has nothing to do with me. So that's the exciting thing, is our students do come off the medications. Sometimes we are taking, let's say, something for depression, and it can cause suicidal tendencies. So we do have to look at the different drugs we're taking, and we want to make sure that they're not giving us adverse effects that are worse than what we would be dealing with otherwise. So we definitely want to understand the mode of action, how these parasite drugs are working, how these drugs are working in the body. And we know how the parasite drugs are working in the body. You can read up on that. But when you're on these disease modifying drugs, they're usually suppressing your immune cells, right? And your immune system is protecting you from infection, from parasites. So you'll get to the place where you're like, okay, I'm doing all these things to support my immune system, but I'm taking these treatments that are suppressing, hurting my immune system. They're not touching the parasites. So I'm going to talk to my pharmacist and find the safest way to come off of it. So, but you do that when you're confident, when you've had a lot of success and you're feeling a lot better. So Anthony, Dr. Alan McDonald. Oh, somebody asked if he passed away. He did not pass away. That was a different Dr. Alan McDonald. What's the process for kids? So our students, a lot of them are moms and dads, and you learn how to treat your whole family. But kids are definitely different. They're usually not as infested as we are, but they can definitely use that special oxidizing agent. They sometimes can use herbs. The diet is really helpful. They don't have to go as strict with carbs with the diet, but they would use a more gentle version. But you're absolutely right. You definitely, if they have a lot of symptoms of parasites, then you definitely want to work with somebody to have them treated properly so that they don't end up with chronic disease when they get older, like many of us have done. So there's a Rose, you're just wondering, you'd like to buy a certain parasite drug online in Canada and something in Florida. So I honestly do not feel that it is safe to treat yourself. Number one, if you use parasite drugs that you don't have those parasites, what is the point? You're taking a drug. All drugs have an LD50, they're all toxic. Don't take something unless you need to. Number two, are you using the right amount? Is it going to be effective? Or are you just making the parasites resistant? So you don't want to hurt yourself, but you also want it to be effective. And what if you're not even using the right parasite treatment? It's not what, I mean, if you want to use the herbs from the health food store, there's no harm in that for sure. But you definitely want to get support from someone when you are treating the parasites, because you never want them to become resistant. Otherwise, you don't have a treatment in the future. And yes, we will be continuing to be exposed to parasites until we are no longer here. They're part of life. They're all around us. No, I do not work with only multiple sclerosis students. We have students with all kinds of conditions, or sometimes they just know. Like one lady I spoke to today, she just knows that she has parasites, and she's been working with functional medicine doctors and they're not able to help her. And she's like, I've spent all this money on all these different herbal blends recommended by my functional medicine doctor, and I'm still sick. And I wish I would have started with you a few years ago. So we work with people that are pre-diagnosis. Maybe they just have symptoms they're concerned about and they really believe it's parasites. We also work, and I'm going to chat with you. I get to know you and meet you before we start this journey. I'll make sure it's a good fit. You make sure it's a good fit. We're going to work together for at least 3 months. But our program, yes, like somebody was asking, what is the time frame? The Live Disease Free Plan, it is a 3-month program where you're getting weekly support in getting ready to treat and then deciding on your treatment plan and then treating. And then there's another 3 months of once a month support because you've kind of got most things in place. But some people that are really sick, they might want more support, after the first 3 months. And we do have grad support. So we'll help you in whatever capacity you need until you don't need us anymore. But this is a skill that you will have for the rest of your life once you get well. You'll be able to take care of yourself. You'll make sure that you never end up in this position again. It is priceless, and it really teaches you how to play that active role in your healthcare. So we do need our practitioners for some things, but there's so much that you can do on your own. And when you really understand what you need and what you don't need, you can really decrease your costs significantly. Like you can save thousands and thousands of dollars, hundreds of thousands of dollars probably over your lifetime. All right. So you're happy to follow how to treat ear infection via Live Disease Free Plan. Your hearing now is normal now. Way to go. That's so awesome, Rose. I'm so happy for you. And Edward, we spoke earlier today. Yes. So you were just wondering why the National Institute of Health doesn't seem to have many studies on the gut. So there's this connection between like the pharmaceutical, it costs money to do research. And so a lot of the research is funded by pharmaceutical companies. And unfortunately, there is, let's say, the University of Calgary, Alberta, that they have, and I've shared some of their studies. They're doing some pretty good work, but they're focused more on bacteria and viruses. They all stay clear. They said, oh yeah, there could be other parasites, but they all stay clear of really going deep. And like if Dr. Alan MacDonald found those, it cannot be that hard to find. He is a really good pathologist. Of course, he would have, understood the best way to prepare his slides and to use, sometimes we have to use stains and et cetera, and how to look, and you need to use specific microscopes, but it's not really that hard. And so what's happened is I think that our healthcare system has kind of been hijacked. And so right now, the vast majority of the treatments and the panel of experts that are deciding how we diagnose and how we treat MS and how we do research, they're really discouraging, at looking at spinal fluid for different types of infections. And in medical schools and universities and doctors, like really nobody's looking at the spinal fluid for infections, which is ridiculous because in multiple sclerosis and all chronic disease, they're inflammatory conditions. Our immune system is fighting something. We know that our immune system, the primary job of our immune system is to protect us from infection. So why are we not looking to see which infections they could be? And, if it's a disease of the central nervous system, then why only look at the gut? Why not look at the spinal fluid? Why are they saying there's no value in looking at the spinal fluid? So unfortunately, Edward, I believe that it has a lot to do with money, that if we treated these parasites, all those and I don't know, maybe you guys can confirm, but one person told me, and she's just a new student right now, she said that the Ocrevus, I probably shouldn't have said the name, but her infusion is $200,000 per infusion. I thought it was more like $100,000 per infusion, but you can let me know if that's true or not. So there's a lot of money involved, and this is why we are not finding a cure. This is why they're just saying, okay, no, 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 we're just going to consider lesions. We don't care how the lesions got there. We don't care what caught. We're just, if you got lesions, we'll see if these drugs help the lesions. And they don't. They don't treat the parasites that are causing the lesions. They just make us weaker because they're attacking our immune system, our B cells and our T cells. And that is the frustrating thing. We've kind of gone all over time. Hookworms, absolutely. So I'm going to let you guys go. Just keep typing your questions in the question box. We will answer your questions, and we'll have to do more of these parasite Q&As because there's a lot of questions that people have. But just know that you don't have to live with these parasites. If you really believe that this is what's causing your disease symptoms or your symptoms that are just scary or annoying, and you cannot get support, make sure to check out our videos we've got an amazing blog post on our website, livediseasefree.com. So much important information. Like, share it with doctors, share it with chiropractors, with nurse practitioners. Neurologists might not be too open to it, but there are some that are interested in the gut microbiome. So just kind of get a sense of how, where they're at. And if anyone wants to hear, tell them about it, share it with groups. You guys can help me to get this message out so that we actually move into the correct direction to treat the cause of multiple sclerosis and other chronic diseases. So again, if this excites you and you want support, watch my masterclass training. Otherwise, please like and share. That helps the algorithm to share this out with other people and show it to other people, because most people that I talk to, they still don't know that parasites are causing their disease. And how sad is that? So I hope you have a wonderful week, and we will talk to you next week. Take care. Bye-bye for now.